Over the past few days, many viewers have been reaching out to us, frustrated. They've had trouble trying to schedule a test or get their test results. Reveal investigator Andy Parati talked to an infectious disease expert about the impact of the state's testing capacity.
Cheryl, the federal government does not have a national testing strategy, which means states like Georgia are pretty much left on their own to do their own testing or relying on private commercial labs. While Georgia has dramatically increased its availability for testing over the past few months, the surge in new cases has impacted people's ability to easily get a test and the time it's taking to get results. Here's some perspective. One of our producers tried to schedule a test in DeKalb County through the State Department of Public Health on Sunday. The soonest appointment available was 16 days away. The state health department's response was simply to try another county. DeKalb County confirmed that the demand for testing is up and that people are showing up prior to their scheduled times, which is increasing wait times. The state says it is maximizing its public labs to get results as soon as possible, but admits private labs are overwhelmed. Some viewers tell us they're waiting 5 or more days for results, while others say they're getting their test results back in 24 hours. We asked Dr. Jo Varkey his perspective on the state's current testing capacity. He's an infectious disease expert at Emory University.
This is the new normal, and I hate that that's the case. I would love to say that we're kind of over the hump or that things will get better. Eventually they will, but we're still at the beginning of this pandemic. And I think that we need to prepare for the fact that when there are these waves, it will strain our lab services.
In your opinion, we do have enough tests in Georgia available?
We do.
Okay.
Correct. But again, if we don't get control of this pandemic, it's going to put strain on all of our ability for testing. And what might appear like a stable supply of tests today may end up being an inadequate supply 1 week or 2 weeks from now.
Andy, clearly people are concerned with the state's testing capacity right now. How do we compare to other places? Is Georgia doing better or worse than other states?
Cheryl, I reached out to colleagues and friends in Seattle and New York City, and their experience getting a recent test has been dramatically different. They say it's been pretty much a breeze, either scheduling a future appointment or just showing up day of, getting the test within an hour and often getting the results within 24 hours. And as these graphs show, their curves remain steady or are down in some cases, compared to Georgia that has seen a significant spike. Some are using apps or simply just going to an urgent care and getting the test for free.
All right, thanks a lot.